Hi, I'm Deborah from South Essex Slings. This video is going to show you the Ergobaby Omni deluxe carrier in a front carry with a bigger baby, sort of small toddler size. So first of all, what we want to do is make sure that your carrier fits your child. So this flap, when you have a newborn baby or a small baby, it should be folded onto the inside. But once they're kind of 2-3 months old, it will be on the outside and it will stay there for most of your carrying journey. Then in your waistband, you want to make sure that the Velcro tabs are on the setting to fit your child's legs. When they sit in that carrier, you want the carrier to reach into their knee pits. So if it's not quite reaching, it needs to go a little bit wider. And if it's going too wide, you need to bring it in a little bit. So adjust the carrier to suit the size of your child. And then your waistband will go on. You will pop your waistband on roughly around where baby's bum sits on your body to keep their head on the firm part of your chest. If you pop it up too high, it won't fit right. And if you put it too low, baby will sit too low and won't end up with a good seat. So wherever your baby's bottom sits on your body to keep their head on the firm part of your chest is where your waistband goes. So you want to make sure that carrier is nice and central on your body, and you can tighten up from both sides so that you make sure that lumbar support is in the centre of your back. If it's off to one side, it may make it a little bit uncomfortable for you. So you want that waistband nice and snug and parallel with the floor, not dipping down at the front. And to prepare your shoulder straps, if you clip that little clip together that joins the shoulder straps, that will end up on your back and it might be a bit tricky to reach. So if you clip that first and then loosen off your shoulder straps, so you've got nice loose straps connected by that clip in the middle, then you can find your child. So you're going to cuddle your baby onto the front of your body, nice and centrally, encouraging those knees to tuck up around you, and their bottom is going to be sat very near that label in the middle of the carrier. You don't want to sit them right on top of that waistband. It becomes very uncomfortable for them and it pushes all their weight down onto that waistband, which hurts your back. So their bottom needs to just be dropped slightly lower than the top of the waistband, and then come underneath that fabric and bring that up and over baby's back. So as you can see, their bottom is in that fabric and not sat right on top of that waistband. Their bum is slightly overhanging the top edge, which is where we'd like it to be. Then once they're in, find that strap, pop that over your head, and your arms can come between the padded strap and the webbing underneath. Push any slack backwards over your shoulders, bring that slack round towards the buckle at the front, and then start to pull backwards to tighten. Bring that slack round towards the front and pull backwards to tighten. You will get to a point where you'll feel like you can't tighten anymore, but it still doesn't feel tight enough. You need to really make sure any slack is pulled out of those straps. Really make sure you've pulled it round. It's one of the downsides of having a strap that pulls backwards to tighten rather than forwards. You have to really make sure that all of that slack is brought towards that buckle before tightening to help get it all out of your shoulders, but also prevent baby from being pulled too tight against your body. Right, once your child is in, you are making sure that they are safe. Their head needs to be high on the firm part of your chest so that they have a nice clear airways. So quick glance down, nice clear visible airways, and their body should be snug against you so that they're not able to fall or slump at all. So nice and high, nice and tight, and in sight are your safety checks. The top of this carrier, once your child has upper body control, they can have the top of this carrier down to armpits if needs be. So that's your minimum level, is armpits. So this is supporting across baby's shoulders, which is fine. If you have a taller child, you may want to button this flap onto the taller buttons to give them more support over those shoulders. But again, armpits is that minimum level. For your comfort, That strap on your back, usually most people like it around armpit level. If it's any higher, it can cause a lot of discomfort through the top of the shoulders and neck. So slide that down, and that's why I've shown you how to clip it first and put it on the way I did. It makes it easier to get it on rather than trying to reach it behind you. And when you're ready to get baby out, you've got a couple of options. One is, if you can reach that clip on your back, unclip that. If you can't, then you can unclip at the sides. And Ergobaby have this sort of tri-lock, so you need to pinch here and push that button at the same time. So you can use 2 hands, or you can use 1 if you need to. So you can unclip here or unclip on the back. Release your shoulder straps, pop your child down, and then you can take off your waistband. If you have any questions at all regarding this carrier or any other, or baby's safety or your comfort, please reach out. I'm always happy to help.